Hi, my name's Peter. I'm one of the sports podiatrists at Shoes Feet Gear. Today we're talking about what we can do for ingrown nails in the clinic. There's usually two options. If we get mild ingrown nails like this one, we can use some careful little tools to go down the side here, painlessly clear out the problem little spike of nail or hard skin or edge that's creating the problem for fast relief. If it's been a recurrent nail and it's happened more than once and it looks like it'll continue to be a problem, or if it's picked up an infection and inflammation and it's all thickened up and hypergranulated and isn't going to settle down without taking the small edge away, then we will use a more permanent procedure. So to do that, first we get the patient to put some MLA cream on to numb the skin, and that makes the local anaesthetic far more comfortable. We don't inject in the end of the toe where it's painful. We do a slightly trickier way where we use the local anaesthetic at the base of the toe and numb the four nerves that run down to your toe. So there's four nerves that run all the way down through here, and underneath there's two as well. So we put the local anaesthetic back here and find those nerves and numb them from the base so that we get a complete block through the whole toe and it's far more comfortable. So that's a great way to make sure the toe's completely numb and we don't have any problems. Once we've checked the toes numb and it's completely anaesthetized, then we follow a procedure, and the main idea is to split this nail down the side. So we only take the hidden bit of nail that's creating the problem. So we use some clever little tools to split the nail through here and then roll that little piece of nail out. We don't cut the skin when we do our procedure. That's an old-fashioned way of doing it and creates a lot of pain, a lot of discomfort once the anaesthetic wears off. That's the procedure that will be painful for weeks afterwards because of the cut in the skin and the stitches. So we've got careful tools that can go under the skin without disrupting that skin that has all the feeling. We take the nail away and then we use a chemical once that root is exposed. So there's some little cells that sit on the tip of the bone there that grow nail. Once we've taken this few millimeters away, those cells are exposed, and we can apply phenol, which is a really strong base. It has a pH of 13, and that cauterizes the root and makes sure that this nail doesn't come back. So there's a few tricks to making sure that this works, and we like to use plenty of phenol to make sure it works effectively. We need to make sure that the nail doesn't split as it comes out, because that'll prevent the phenol working. We need to use a tourniquet, so a little rubber band to keep it dry. That's another reason why these can fail, and also make sure the phenol is fresh and nice and potent. So once that nail's removed and the root's treated, the skin just pushes back up against the edge of the nail, and when you cut your nails long term, you only have to cut to this point here. You don't have to go diving down the side. So it looks great. There's no scars on the skin, there's no funny spikes of nail, and the nail is still visibly quite natural and normal. So it's a great procedure and gives a permanent solution. After the procedure, anaesthetic wears off in about an hour or two, and no more than Panadol or Nurofen for the first 12 hours. Most people don't need any pain relief. It's quite comfortable because we aren't cutting that skin, but within 24 hours, patients are pain-free and ready to go. So if you'd like to book online, www.shoesfeetgear.com.au, or call our clinic for more details.